On the table is cosmetic dermatologist Dr. Sabrina Fabi. Thanks for being here. Let's talk about this study and what it found. It tested about 100 women in a pretty big age range, like 18 to 45.
Right, and they found that they were positive in their urine samples for some of these chemicals. That what's more scary about these chemicals is that they're associated with reproductive issues. So some of them, like some of the phenols that we find as preservatives in some of our products, as well as some of the products that we find in many of our sunscreens have been associated with a decrease in estradiol, which is a type of hormone. And then other chemicals, like what we always hear, parabens or BPA, have been found to increase these levels. And so then now this raises concern if this plays a role in some of the reproductive issues that we see with women of childbearing age.
Is this a study that is unlike others that have been done before? I mean, who regulates and oversees these products?
Yes, well, that's the scary thing. In the cosmeceutical industry is not really regulated by anyone because they are not drugs, and technically they're not having biologic effects on tissue, and so they're not regulated by the FDA, like let's say some of the drugs that we inject or other topicals that are considered true drugs. And so because of that, no one's regulating these products, and so people can create a lot of claims. And so it really comes up to the consumer being aware of these types of study results and being more mindful of the products that they're purchasing, making sure that they don't necessarily have some of these ingredients.
So are you talking about like eye creams or face lotions or makeup? I mean, what are we talking about
here?
We're talking about
body lotions that you may be even using on your children that are young men or young boys that are in their reproductive ages, right? And if they're exposed to things that increase their estrogen levels, that could have an effect. Some of these sunscreens, right, if we're putting them on our babies, we have to be careful. We really want to be using things that are more zinc oxide based or titanium dioxide based. They don't have these benzophenones because we do know that they can have effects on some of these hormone levels.
So what specifically should we look out for? I mean, if you say they're not really regulated, couldn't they put just about anything they want on these boxes?
Well, yes, of course they're going to pull things that have been found to have detrimental effects, right? But you don't want to wait until that happens. You want to kind of stay ahead of the game. And so making sure that you're looking for products that don't have parabens. Now we're seeing more and more of a push for that, so paraben free. Using sunscreens that are titanium or primarily zinc oxide based instead of the chemicals, so not sunscreens but physical blockers would be great.
Are those called, that's the mineral
based, the ones that usually are advertised for children. And then using things that don't have BPA or chlorophenols.
Sheila McGaffrey sits for a few hours hooked up to an IV once a week.
A little bit of the pen.
She's getting chelation therapy, which helps remove toxic heavy metals from the body. Sheila has been diagnosed with high levels of lead, aluminum, and mercury. She believes the main culprit has been her favorite beauty products.
So what I use is face cream. I use lipstick, lip pencil, concealer, eyeshadow, mascara.
Any issues, any side effects?
Sheila's physician, Dr. Salerno, says makeup companies aren't required to list contaminants on labels.
They can affect our nervous systems, they can cause fatigue, they can cause headaches, dermatitis, problems with reproduction.
So you might be thinking, I don't use that much makeup, and how worried do I have to be? Well, doctors say the average woman absorbs about 5 pounds of makeup into her skin every year.
The skin, being the largest organ in the body, is absorbing these heavy metals, and on a continual basis it will accumulate.
Patients like Sheila are now resorting to chelation. The FDA-approved treatment occurs over the course of 10 $250 sessions. Patients get a mixture of vitamins, including calcium EDTA, which binds to the heavy metals and flushes them out.
We're going to run you slow.
Sheila says the first treatment left her feeling flu-like, but now she's swapped out all of her makeup for lead-free products.
Okay. The first thing you need to know is that the skin is a human sponge, okay? It's like a little sponge, and it absorbs things, okay? So everything you put on your skin goes directly right in. I mean, think about the last time you used hand lotion, right? You put all this lotion on your hands and then it disappears. Where did it go? It went right inside. An average female will absorb 4 pounds and 6 ounces of chemicals every single year. So here's an example of 4 pounds. Okay, of course, probably eat a lot more sugar than that per year, but this is 4 pounds, right? This is how much chemical goes into your body through the skin every year. That's a lot. And there's about 515 different chemicals put on your skin every single day. From hairspray, blush, foundation, shampoo, conditioners, deodorant, like aluminum, for example, body lotions, hand cream, eyeshadow, lipstick, nail polish remover, which is very, very toxic, perfumes, fake tans, all sorts of things that you're exposed to on a daily basis. Here's the problem. Some of these chemicals are carcinogens. Those are things that can cause cancer. The problem is there's always a delay between cause and effect. You start accumulating these chemicals, you don't know when potentially you could have a problem down the road. So it's really hard to connect the dots. Some of these chemicals are neurotoxins that go into the brain and the nervous system. And then there are other things called endocrine disruptors, which are things in the environment, chemicals that mimic estrogen. And so they affect the different endocrine glands like the thyroid, the pancreas, the thymus, the adrenal gland, the ovary. All these chemicals create damage on the inside, which then affects the outside, okay? And then you need more makeup to cover up all the blemishes and the dry skin and the unhealthy look.
30% of people react badly to perfumes because perfumes have things called fragrances in them, and they're able to hide the ingredients, which can be up to 5,000 chemicals. The one we worry about the most is something called phthalates, which can lead to birth defects, actually. But we don't know in what amount, so I don't want to scare people. It's
what, even like smelling? I mean,
very trace amount.
Little...
But here's the problem, Eric. It's something called fragrance sensitivity. It's not even necessarily an allergy. It may not involve your whole immune system, but you're there, you have a headache, you have runny nose, you have runny eyes, you get short of breath, you're itchy. That can be a reaction to the fragrance. If you have an underlying allergy or asthma, you can have some issues with breathing. I may have to put you on an antihistamine. But the best thing, of course, is to do what David said at the beginning. You know, use the scent-free stuff. Now, if you use the stuff that doesn't smell, you might smell a little. So take a shower before you go to work.
But when you're saying use scent-free what, though?
30% of people have a problem with these perfumes, which is why I'm agreeing with her that it's something to be concerned about.
Scent-free deodorant?
You can get scent-free deodorant. You can get scent-free soaps. You can get scent-free... All of the regular cosmetics.
Well, there are always ways that you can communicate with them and to make sure you're not hurting their feelings. But this is a real problem because all across all of our products, nail polish to hairsprays to you name it, the plastics, you have these called phthalates. And these phthalates, there are a lot of studies being done that we're finding out that in men, it can actually reduce the amount of testosterone. It can cause like a lot of infertility. It can affect the sperm motility. So it's a real deal. In women, phthalates has been shown to cause what we call polycystic ovarian disease, where the menstruation cycle can change. These are endocrine disruptors, meaning that they change your hormones, whether it's estrogen or testosterone. It's a real deal. Can you avoid it? If you test 100 people out there, 95% of them in their urine sample are going to have some degree of phthalate. My advice to this patient is if you sit next to this guy who wears a lot of cologne, just very nicely say that it's affecting my sinuses, I don't feel comfortable, and you can build allergies to it.
Really important. Whatever goes on your skin goes in your body, affects your body, and becomes part of your body. So before I wrote Memory Rescue, I never really read ingredient labels on the deodorant, shampoo, bath soap, hair. I mean, I have no hair now, so it doesn't matter, but sunscreen and so on. But things like parabens and phthalates, fragrances, PEGs, they're toxic for your body. That many of those are called hormone disruptors. And, you know, and as you age, you mentioned menopause, and people know I turned 65 this year. As you age, your hormones go low and low, but they don't have to. It's often an accumulation of the toxins that we put on our bodies.
Mm-hmm.
And most parents don't know. And often I've heard with my addicted population is, oh, I didn't drink or I didn't do drugs when I was pregnant. As soon as I found out I was pregnant.
But the 2 months
I
it took you to
stopped.
find out.
And when does the baby's brain start to develop in utero? Week 3,
Right.
when they don't know.
Right.
And so when the baby's brain is just starting, it could be bathed in drugs, alcohol, or now we know. I mean, who knew? I didn't know this. Toxic products that can be harmful to the baby's DNA.
The exposing factors with using sunscreens, how toxic it is to actually use chemical-based sunscreens. It's summertime. The medical profession recommends that everybody slather sunscreen on their skin at least twice a day. The main concern that I have is with the babies, the children, all of these toxic chemicals that are involved in these sunscreens. So today I just want to bring awareness to everybody. The active ingredients are going to be the ones that are extremely toxic. The most common ingredients in sunscreens is called oxybenzone. Oxybenzone is an endocrine disrupting chemical. Now that means it's a chemical that disrupts your hormones in your body and acts almost like an estrogen. It's responsible in clinical trials for increased risks and increased rates of melanoma. It's been found to lower the birth weight of girls. It's also been linked to allergies, hormone disruption, cell damage, and skin cancer.